Hello and welcome to our Health and Science Focus. I'm Yuveka Rangapal. Now, for many people, being diagnosed with any cancer feels like a death sentence. But it doesn't have to be, especially with breast cancer. It is Breast Cancer Awareness Month, and now we're hearing of the increasing number of women and men who are being diagnosed with breast cancer these days. But at the same time, we hear of an equal number who are beating it. We know early detection is key to saving lives, and there certainly is life after breast cancer. Many survivors going on to live healthy, happy lives, many women even going on to have children. Yes, it's a scary, exhausting fight, and there are often literally scars to show for it. Today, the medical experts and those who've done battle with breast cancer, a woman and a man, will give us insight into how we can give ourselves a fighting chance. My first guest, renowned breast cancer expert, Dr. Carol-Ann Benn, has written recently that every woman who suffers a blast of cancer has a superhero inside of her. Well, what does she mean by this? Let's find out. Good morning, Dr. Benn. Thanks so much for your time. I happened upon this article that you wrote in this magazine earlier this week, after we had already arranged you to be on here, and I saw this article saying you are a marvel, and that is what you say. Captain Marvel, a female superhero. Her start in life is that she's a woman, talented and unique just like you. She never expected to become different. Yeah. So how have you linked this? What are you saying to breast cancer survivors or those who've just been diagnosed?
So I think the thing is there's such a fear around, we feel a lump, we're not sure what to do, could it be a cancer? The word is so frightening that and it's going to change your life, you know. So we want to take away the concept of the fear. So people know when there's something wrong in their breast, and really we want to tell people, don't forget to examine your breast, flatter the hand, check that the nipple's not being pulled in, check glands under the armpit. If you feel something different, go and seek healthcare advice. Remember, we want informed consent. We want you still to understand it's your body, not the doctor's body, not to rush into operations. Be treated in a multidisciplinary environment. But know that today, 9 out of 10 ladies with breast cancer are alive and well 10 years down the line. So it may be that you may require some oncology treatment, chemo, medicines that put you into menopause. You may and probably will require an operation, and don't rush in, because 7 out of 10 ladies do not need and can have a breast-saving surgery, do not need their breasts off. We can reconstruct immediately.
That's fantastic. So that's relatively new, isn't it?
Well, we've actually been doing that for over 20 years. Wow. Unfortunately, in this country, it's people get pushed into the door of the surgeon. They get told it's an emergency, it's a cancer, and before they know it, they have their breast or both breasts off. And I want, by talking about these articles like You Are a Marvel, take time, know it's your body. Yeah. Okay. Talk to your doctors, go for second opinions. Realize that you're on the same level as your doctor. In fact, you are the most important person in the room. Take someone else to the appointments. Question. Take time with your decisions. It's not flu.
What are you seeing in terms of when the news is broken, when somebody's being told this is what you have breast cancer? What are the top concerns for patients, men and women? So
I think there's fear of death, okay, there's fear of losing their breast, and there's fear of having things such as chemotherapy. So the concept that breast cancer is something that's going to rapidly go around your body, we need to take away from. Breast cancers are slow growing. So I saw a lady today who follows astrology cycles, and she's booking her surgery in November around moon cycles and everything. We're not asking for people to delay treatment for months and months and months, but what we are saying is we must talk to people, understand them, and hear. A lot of the cancers are quite slow growing. Everyone must have a discussion with a team of doctors. So not the surgeon decides to cut and the oncologist decides to give chemotherapies. So we take time with our diagnosis. The other fear is finances. Yeah. When people go for needle biopsies, it can cost 5,000–7,000 rand. So the diagnosis is not made in the surgeon's rooms. If they see something concerning either on your examination or on your mammogram, take your reports. If you want, go for second opinions. And I run a massive government unit at Helen Joseph. Yes. You can access excellent care in a non-private environment. Healthcare is a fundamental human right.
So the lack of funds should not hold anybody back. Let's just go back to basics.
Right.
From what age should we start to do those checks? From what age should we start to check and know our bodies also, from what age should we be looking back at our family histories?
So family history is critically important on your father and your mother's side, and we want a combination of young cancers in your family: breast, stomach, colon, ovary, skin melanoma. We want a collection of those. The next issue is when you've got breasts, examine them. So breast cancer is neither ageist, racist, or sexist. We see it in men, we see it in women, we see it in people of all ages. Last year I was treating an 18-year-old who they flew out from Mauritius for me to treat, and you don't expect it, no family history. So you examine your breast always once a month, 1 week after your menstrual cycle, or pick a calendar day. And I always say, you know, gravity hates women. There's nothing worse than you lift everything up and everything shakes and wriggles down, particularly when you've had 3 kids and you're over 50 like me. But stand in front of the mirror and check your body. Lift your arms to the side so you can see if anything's pulling your nipple in. Use the flat of the hand and know you. So your breasts might be lumpy, bumpy, or they might not. But if you're checking them every month, you will know if there's something different.
Yeah.
That's when you must access healthcare. Don't be scared.
So who is your first stop once you've realized that, that something is not
I think
right?
anyone can be your first stop. You can go in, so for example, we have an open access clinic on a Tuesday morning at Helen Joseph if you don't have access to funding. You can see your GP, you can go and see a radiologist, but I think you must take responsibility for your body. So the important thing is if you go to a doctor and you say, I'm worried this doesn't feel right, and the doctor goes, it can be hormonal, come back in 3 months, or you're pregnant and it can't be a cancer. That's nonsense. It's the commonest cancer we see in pregnant women. You then go for another opinion. We use an ultrasound to pick up lumps in the breast, and if you're over 35, a mammogram and ultrasound. But again, check costs. Know you can access healthcare across government and private facilities.
So what are the things we should be aware of? Because we're always talking about early detection, we're talking about prevention as well, Doc. So let's just talk about the things that we need to start doing from now before we get to the point where we find something. What's the risky behavior here?
So the fact of the matter is that you can't prevent something. It's a bit like you're going to check your bodies, and screening is to pick up things. So not everyone's going to get a breast cancer, but it is the commonest cancer we see in women. Exercise decreases your risk of all cancers by 42%. Weight gain, keeping your BMI under 25, very important. Again, habits, we call these modifiable risk factors. Smoking and alcohol. So you can modify certain risk factors. Don't stay on contraception and hormone replacement for years and years if you don't need it. Don't take a headache pill if you don't have a headache. So you want to make sure that you are fixing what you can fix, but you can't fix your family history. You can't fix when you have kids, and you can't fix for some women if you breastfeed. So people must take away the guilt. It's not something you've done wrong, but let's deal with what we've got.
So let's talk treatments then.
Right.
Let's just talk, when is it necessary? You mentioned earlier not everybody will have to have a mastectomy, not everybody is going to have to undergo surgery. When is a mastectomy necessary?
There's
when is it required?
only one indication for mastectomy, and it's a type of cancer called an inflammatory breast cancer. Otherwise today, unless there's cancer throughout the breast, most women can have a breast saving operation. Choosing to take your breast off is choice, and we do nipple and skin sparing today and immediate reconstruction. The principles of care, the umbrella of care, is that no one died of cancer in the breast. It's cancer's ability to spread. So don't rush into an operation until you understand the type of cancer. We divide cancers into different types, 4 different types, and they're treated differently. So there are many oncology medicines for different cancers. The aim is to kill the cancer first and then take out the area where it is second.
Is chemo always required? And I know
Not
there are
at
different
all.
types. Some take pills, some actually have radiation.
So cytotoxics are medicines that kill cells, and that's what we colloquially know as chemotherapy. But there are many different types of medicines. There are target medicines, there are immunotherapies, there's hormone manipulation medicines. So there's a combination of medicines. And people are scared of side effects of treatment. It's no different from taking your blood pressure medicine or your diabetic medicine. A lot of the side effects can be managed, and they don't have to be permanent. You want to understand, detail what's required, and know that there are different options as well. So in a subset of patients, we can freeze cancers today, and we can give little blasts of radiation in theatre. There are so many innovations that are happening all the time. So that's a good thing.
In terms of alternative therapies, and we often hear about, you know, and let's go back to the marijuana, the medical marijuana discussion and all of that. When do those come into play?
So I like to call it complementary, not alternative, because I like holistic medicine. So, I mean, I'm a bit of a supplement junkie. I probably, whether it works or not, I don't know.
Which supplements, Doc?
Okay,
don't tell us now. Okay.
So the fact of the matter is, it's my security blanket. There's no data that anything I'm taking is of benefit. It's a bit like the zinc and the vitamin D we've all been popping around Corona. So the fact of the matter is, people take things, and when you're anxious, you might take more. So I want an honest communication with you and your doctor and what you're on, because some supplements can make your effects of your treatment worse or inactivate your treatment or create bleeding around surgery. But holistic medicine is working with traditional doctors, working with integrative healthcare specialists, your homeopath, understanding that, yes, you can use medicinal marijuana for some types of breast cancers, not to treat, but to decrease symptoms. But for other types of breast cancer, it actually makes the cancer worse. So you've got to understand that all things are medicines. All herbs are medicine. I mean, they've used them since the beginning of time. You just need to understand that they may not have pharmaceutical studies, so we might not have dosings and things accurate. So be honest with your doctors, okay, and have that open conversation and make sure that we are equipped to manage all aspects of you, not just your complementary, what medicines you're taking, but your psycho-oncology too. Things like your husband, your children, managing the family around breast cancer is critical. Critical.
Does it present differently in men and women, breast cancer?
So it can, in that men have less breast tissue unless they've got gynecomastia, moobs, male boobs, which is not an increased risk, but then it sometimes can be harder to see if you've got more breast tissue. It also usually presents with a lump, but it can also present with a leak from the nipple or a change on the nipple. So men know you have breast too, and if you have a hard lump, please make sure that you have an ultrasound, and what we do is a needle biopsy, and it's treated identical. Breast cancer is the commonest cancer we see in pregnancy. So pregnant ladies, if you feel funny lumps, must go for sonars. So we must just be aware of all
And that
these
could
things.
be tricky, because when you're pregnant, your breast starts to change, and the texture, you're feeling different things.
So that's why having something as simple as an ultrasound is not harmful. I mean, that's how we check the babies anyway, just to make sure you're not missing anything. So we want people aware. That's why these programs such as this are critically important, because they make people aware. But secondary to awareness is access. People must have access to health care in such a way that's affordable to them, and that's very important.
When it comes to mammograms, Doc, is there a particular age where you should start? I mean, would you say to an 18-year-old that you need to have a mammogram?
No, an 18-year-old won't have a
without family
mammogram. An 18-year-old will have an ultrasound. So the density of breast ultrasounds. Screening is health economics. So the whole world usually screens from 50 yearly or twice yearly. But if someone at 38 presents with a breast mass, we'll do an ultrasound and a mammogram on her. So generally from above 35. But if you're part of a screening program, it'll usually be from over 50.
All right, so it's time for a bit of a demo.
Yes.
We touched on it earlier. You spoke about what you actually need to be checking. So please show us the actual checks, or maybe you can do it, or if you have a partner you'd like to do the checks for you,
so
can probably help you as well.
So you know what? 50% of breast lumps are picked up by someone's significant other. That's very important.
Because often they know them better than we do, right?
Absolutely. Okay, so yes. So the good news is it's a family show, so I'm keeping my top on.
It's okay, yes, please do.
Absolutely, okay. So what you're going to do is you're going to stand in front of the mirror, lift your bra upwards, because by doing that, your breasts have a jiggle. So you want to see that there's nothing moving on the skin. And then you lift your arms slowly to the side. I've got to watch the mic there. So by lifting your arms to the side, you look and see if there are any dents on your skin or if the nipple is pulling in. Then what you do is you take the 3 fingers of your hand. You're going to use your left hand to examine your right breast and your right hand to examine your left breast. You do it standing and sitting. And you feel your breast gently. I find too many people press too hard. And by doing that, you actually can't really feel the lumps. Feel gently and you'll feel all the little breast bits. Feel around your nipple. Don't squeeze your nipple, because the breast is an organ for blondes. It's the only organ that if you squeeze something, it will produce a liquid.
Oh, okay.
Yes.
I didn't know that.
Yes.
Okay, at any time.
Anytime you can induce a liquid. So don't squeeze it, and it also causes pain.
Oh, yes, of
So
course.
you go all the way around the breast, and then when you feel your glands, you relax your arm and you feel softly, and we all have glands.
Yeah.
Now, what is interesting for me is when you go for a sonar, they lift your arm above your head, and by doing that, it pushes the tissue out, so you can't feel the glands.
Oh.
Yes.
So why do they do that then?
So on a lot of the magazines it says do this. You've got to relax it slowly. Now, 1 in 5 women have extra breast tissue. You know when you put on that summer top and you see this...
Oh, that I'm the 1 in 5. Yeah.
And we all
The
think
little peaky ones,
you
yeah.
think you can diet it away, but you can't.
No, you
It's
can't. You've got to tuck it away, actually.
It's extra breast tissue,
Yeah.
and you need to check that. So 1 in 5 women have that. So get into a habit, practice. And if you're not sure, go and see a doctor. And I mean, I'm always happy to teach somebody how to do it and what to find to. Because you feel softly with your fingers, and then you know your norm.
Yeah.
By checking each month, you are checking for differences.
Is there
with
any
you.
particular time of the month we should be doing this? Because
Right.
our bodies change at a certain time of the month.
Absolutely. So if you're seeing your menstrual cycle, wait 2 or 3 days after your menstrual cycle. If you're not seeing your menstrual cycle, just pick a calendar day. Just say, I'm going to do it on this day of the month or that day of the month, and then you remember it from there.
All right, so Doc, just a final message from
Yes.
you. And, you know, before you go, you've written this wonderful article here about You Are a Marvel, what we
Yes.
touched on at the beginning. So just a final, I think, positive message
Yes.
to our people out there, our
So,
viewers.
so my patients inspire me. That's why I wrote this. Going through a cancer diagnosis, you've had that blast, you've been changed. Your life is not the same as what it was, but it can be better. You have to deal with different things, different scars. And I always say it's no different to what we all go through in our lives. But you can make something better out of it. You've got to learn to cope with the changes and redefine the new you and love the new you. Because you know what? You are awesome, and you're an inspiration to all of us.
Fantastic. And I have a friend who's a doctor who had that double mastectomy
Yeah.
last year.
Yeah.
And she's so happy with her perkier new pair. She
There you
says
go.
something good came out of this. So there's always a silver lining to that. Thank you very much, Dr. Carol-Ann Benn. Absolutely wonderful chatting to you. She is one of our leading experts when it comes to breast cancers in particular.